Ms. Borkland, following up on Mr. Ryan's comments on page 16 of the bill, section 102, let me ask you if my understanding is correct. If I am not in Congress and I walk out to a health care provider in 2013 or 2014 and want to insure myself in the individual marketplace, my only opportunity, the way I understand it, will be to go to the public plan or go to the government exchange?
Your opportunity in the non-group market will be purchased through the exchange, of which the public option is one option or choice for you. The new reformed market, where you will not have discriminatory practices.
So those would be the two options.
Transparent information would be the exchange.
Or the public plan will be the two options.
Public option is one option within the exchange.
Okay, so the exchange will be the only option. The public options within the exchange.
Private options and a public option within the exchange.
But the exchange is the only place I could go for health care.
It is the equivalent of the non-group market today.
Okay, so if I work for an employer, whether it's a union plan or a non-union plan, that I am happy with today, but in 2013, that union plan or that employer plan does not comply with the exchange, will that plan have to change?
No.
There's not a requirement that employer plans or union plans that do not comply with the exchange, the requirements of the exchange, those plans do not have to change and comply.
The plans that participate in, there are market reforms that apply inside and outside of the exchange. Employer-sponsored plans, whether from a business or a union perspective, have a grace period that they are coming into compliance to meet the essential benefits.
They do have to change if they're not in compliance with the new rules.
They have to come into compliance over a period of time with the essential benefit minimums.
So what the President said is incorrect then, because if I have a plan that I like, that everybody likes, that the employer likes, the union members likes, if it's not in compliance over the 5-year period with the new exchange, the rules of the new exchange, if it's not in compliance, it has 5 years to become compliant, which means it has to change.
Again, the group plans that are not offered as part of the exchange are not subject to the exchange rules.
I'm not talking about that. I'm talking about a current plan that I like, that I am on. If it doesn't, if it's an employer plan that does not comply with the new regulations in Section 102, the way I read it, it means if it doesn't comply, it has to go into, it ceases to exist, essentially.
Yeah. The sections in 102 are set at a level that all the information we've received to date is that the employer plans meet these levels today, but they are not required to meet them until 5 years out.
So if they don't meet them in 5 years, they have to change or they have to go into the exchange.
By 2018, if they have not come into full compliance with
even if everyone likes the plan, they have to change.
The change that's being talked about here in terms of people liking the plan is having some basic essential benefits covered that all indications are the employers do.
That's not my question. My question is if they like the plan and it doesn't comply, they have to change. That's just a yes or no answer.
I suppose if they want to have a contribution from their employers and essential benefits and the employers didn't offer it, they would have to do that.
I yield back my time.